Welcome to the Stay-at-Home Nurse Podcast. I'm your host, Deanna Cooper Gillingham. For over 25 years, I've strived to use my nurse credentials to find work that fit my lifestyle, whether it was raising my 4 children and 3 fur babies, traveling the world, or moving to Mexico and living on the Caribbean Sea. Sometimes I succeeded, and sometimes I failed, but I always learned from the experience. Now, I want to help you by sharing what worked and what didn't work. There are so many opportunities out there for nurses today. The Stay-at-Home Nurse Podcast will inspire and equip you to have a nursing career that is meaningful and supports your lifestyle. Now let's get started. Welcome to this week's episode of the Stay-at-Home Nurse Podcast. Wow, have things changed. At the time of this recording, we are going through the COVID-19 pandemic, and I usually batch record these in advance, so the last probably 3 to 4 weeks that you've heard had been recorded before the pandemic occurred. I wanted to make sure when I was picking a topic for this week that it would be extremely timely now, but also something that would be relevant in the future, since podcasts are out there forever. So I decided that this week we're going to talk about working from home during the COVID-19 pandemic. And although this is the COVID-19 pandemic edition, the things that we're going to discuss could really be valuable and timely at any time. So right now, many people are suddenly working from home, or they're no longer working, or they're working a lot of overtime, or they're working in an area that they're not used to working in. So I wanted to address one of those issues. Those are the people that are now working from home or no longer working. I personally know people that were working at an outpatient surgery center that are now laid off. I also know people that worked at outpatient surgery centers that are now being assigned to different areas that they haven't worked at before. I know people in the same position at physicians' offices. They may have been working from home or they've been laid off. And then there are some medically fragile workers that are being allowed to have a job accommodation and work from home during this time. While some employers will choose to lay off their employees, others will restructure their workforce. And I believe that if you make yourself invaluable by adding crucial value to your company, that you will be one of those that is restructured. In fact, I believe that you can create your own job. Now, to do this, you need to be innovative. And I know you can be innovative because you're a nurse. Now, the best time to do this is always before the crisis occurs. But we can't go back in time, so let's look at what we can do. I believe at this time your goal should be to work remotely whenever possible, while still adding value. This way you can be safe, you don't need to be in harm's way, and you can still add value to those that are in the front line supporting them. So how do you propose this to your employer or your potential employer? You have to show the value, what's in it for them. This is not about you. Although it is about you, and it is about you providing value, they only want to know what's in it for them. So I'm going to give you some examples. Is your employer ready for telehealth? You could start a task force to research this. There is a platform called Zoom that is actually HIPAA compliant. It's a video platform that can be used for virtual appointments. Also, the government has relaxed regulations regarding virtual appointments and telemedicine. So if you were to research all of this and come up with a plan about how your organization could move from in-person visits to telehealth in this pandemic era, you could potentially create a job for yourself. You can also find another problem and come up with a solution. For example, are there too many ER visits? You could set up a call center for your organization to do virtual ER visits and triage. And then there's also calling and screening the most vulnerable. The elderly, the people with multiple comorbidities that are no longer getting into the doctor's office to get their A1C checked and to get their hemoglobin checked and to get all this preventative care. Are there things that we can do over the phone to reach out to them and make sure that they don't fall through the cracks at this time? These are just a few examples. You need to look at the organization that you work for or that you would potentially like to work for. Look at what strengths you bring to this situation and this problem and what solutions you can bring. Then you can write this up in a formal proposal and present it. Now, getting this buy-in is just the tip of the iceberg. Work from home is very different than working in an office. And I would suggest that when you go with this proposal for this new value-added position that you're creating, that you would also let them know your plan for working from home. There will be some resistance, and the more answers you can have in advance, the better your chances of getting this to successfully go through. Work from home setup takes time. Let your employer know up front that there will be bumps in the road, but that once everything is ironed out, it will be invaluable. If possible, work with somebody in the IT department to have designated teams working on the work from home project, getting people set up. This is where companies who already have the option to work from home for some of their employees really have a leg up, because the IT department already has policies and procedures in place. But even if they're not in place, we can still move forward. Now, there will be IT issues such as internet access. Is it appropriate? Does it have the bandwidth that is needed? Access to programs, firewalls or lack of firewalls, usernames and passwords, especially if you're using a different computer and the usernames and passwords are stored on the computer and you don't actually know them. There's equipment and software issues, compatibility issues, and then there's issues with lack of equipment like printers, faxes, actual landline phone. But these problems have all been solved, and they should not stop you from being able to work from home. Again, they're just speed bumps. Now, after working from home, some people will want to make this a permanent position. And right now, there are a lot of things that are relaxed because of the pandemic. For example, HIPAA laws are relaxed right now regarding having to have equipment such as telephone lines and internet service that is HIPAA compliant. Also, with video teleconferencing, you can use things that are not HIPAA compliant. But if this is something that will possibly be taken long term and you want to look at the long-term goals, it's always better to start off looking at that from the beginning so that we're going in the right direction and we don't have to redo things later. So if this is something that possibly could become a permanent position, work from home, there's a couple things I would like you to consider. At the present, the government is giving leniency regarding HIPAA, but this will not always be the case. So when looking at platforms for maybe telemedicine, look at something like Zoom that is already HIPAA compliant. They have actually already had their approval, that they're HIPAA approved, they can do virtual visits, they actually can take over the camera and look at things like if there was a mole or something that needed to be looked at, they can zoom in on it. So this is a system that is already ready for medical to use at home. Also, right now, the billing allowance for virtual office visits is now without restriction. What this means is before, for a doctor to bill for a virtual visit, the doctor and the patient had to be a certain distance from each other. But now that has been rescinded, and for right now, that is not the case. Many experts believe that this will continue. This will be one of the benefits that come from this whole COVID-19 thing, and that we will be able to have more and more virtual office visits. Now, again, if you want to make this long-term or permanent, start incorporating best practices now. So, best practices means, number one, you have a secure workspace. A lot of people are being forgiving right now, and you can pretty much work at your dining room table if you need to. But this really is not going to fly for long. We're in crisis mode. You can get away with it. If you want to potentially ever work from home, then you better start right now showing your employer that you can handle it. And one of those things that you need to be able to do is prove that no one can hear you when you're speaking to your client or your patient, or about your client or your patient. Nobody should be able to hear you. So you should be in a room where you have the door closed, and if need be, the window closed, if there are people that are outside that window that can hear you. Also, nobody should be able to see your computer screen. Any files or papers with anything, even notes that you write that would have any protected health information, need to be locked down when you're not right there observing them. And you need to lock your computer every time you walk away from it. These are just a few of the things. Anything that you would do in your current work environment, you need to do in your new work environment, which is your home. Another thing that you would want to consider is most people do not consider Wi-Fi as secure internet. So if you want to do this long term, you'll need to look at hardwiring your internet. Remember the old cables we used to have? Yes. Going back to that and not Wi-Fi because it's not as secure or somehow securing your Wi-Fi. And then landline versus cell phones. Cell phones are not as secure. So if you don't have a landline, you may want to consider that. Or the institution you work for may put a landline in. So you want to make sure that your house is set up for that. I know a lot of houses now, it's hard to even, newer homes may not be set up that you could even have a landline in it. There is software for cell phones that would be HIPAA compliant and for regarding calls and texting. And so you need to look into that if this is something that's going to be permanent and you cannot get a landline. The other thing you need to consider is licensure. In normal times, the clinician must be licensed in the state where the patient is. This means that if you are in, let's say, South Carolina, and your patient is across the border in Georgia, you cannot call that patient and practice within the realms of your license without having a license in Georgia also. Now, right now, that is being relaxed, again, because of the COVID-19. But in normal times, you need to have a license where your patient is. That's where you're practicing medicine on a patient of that state. Now, many states have compact license, which is wonderful. If you're in a state that offers compact license, this is a benefit for anybody who wants to work from home. Many jobs require a compact license. Another thing I want you to consider is you cannot work from home without childcare. A lot of people think that they want to work from home because they want to be able to take care of their kids and they don't have to worry about childcare. But your children cannot interrupt you. Nobody should interrupt you. And nobody should even be able to know that you have children or fur babies with you when you're working. So they must not be heard. They must not be seen in the background. If you're on a video, you really need to be very cognizant that you need to have some type of arrangement where the children will not be in the same room as you, and there is somebody else, especially for young children who still need supervision, that is supervising the children. Remember, you are a professional and you're working, whether you're working at home or you're working at the hospital or you're working at the doctor's office. If you wouldn't do it at the office or the hospital, don't do it while you're working from home. Next, you must have a designated workspace, and we talked about this a little bit before. When I worked from home, I had a room with a lock on the door and a key. And when I left the room, I locked the door with the key, kept the key on me. At night, I would keep it, with my other keys, but it wasn't something that would be easily accessed by somebody else. I also had a file cabinet that was locked. And so if I was just stepping out of the room to go to the restroom or something like that, the file cabinet was always locked unless I was in there using it. It needs to be a quiet space. And you need a shredder or something for HIPAA so that you can shred any papers, any notes, anything like that. That was something that you would normally have at your employer that you would have to have with you if you're going to be working from home. Now, when you initially start working from home, and we talked about all the bugs and things that need to be worked out, after about 1 to 2 weeks, most of these kinks will be worked out, and you should be working as productive or more productive than you were working previously. You don't have as many distractions, you don't have as many meetings, and you don't have as many interruptions. So most people find that once they start working from home, they're actually more productive than they were when they were working outside the home. Now, here are some ideas for creating a work from home job for yourself. Phone triage, phoning each patient that was discharged from the emergency room within 24 hours of discharge, and then setting up a second phone call and subsequent phone calls if needed. Phoning each patient that was discharged from the hospital within 24 hours of discharge. Phoning COVID-19 patients that were sent home, either after hospitalization or after testing positive with not severe enough symptoms to need hospitalization. Screening of high-risk individuals. This would be people that are maybe 60 and older, giving them a phone call out of the blue and just checking in on them, answering any questions, teaching them about what does this mean, the social distancing, what does it really mean, why is it important, answering any questions that they have. There's a lot of anxiety and fear for a lot of these people, and a phone call from a healthcare professional to give them some instructions and reassurance can be very valuable. And if you get approved for this, and you can actually do this, whether short-term pilot program or maybe long-term, keep track of your numbers. This is so important if you want to do this long-term. And it's even important for short-term just to show the value that you brought to your organization. If you can show avoided readmissions to the hospital, if you can show avoided ER visits, maybe somebody was planning on going to the ER, but then because you reached out to them, they did not go. And having patients tell you how valuable this was to them, if they tell you thank you so much for the phone call, you can give them the address of a supervisor or the CEO to write to and ask them to write a handwritten letter telling how valuable that phone call or that outreach or whatever you provided was. Right now, a lot of people are sitting at home and they're lonely, and people that would never take the time to write a handwritten letter and mail it will do it now. Now, if you decide that you want to request permanent work from home, a few things to consider. You should have a proposal in place when you go to your employer addressing any concerns that they may have, such as the things we discussed earlier, access to a quiet and secure work location, a child care contract showing that you will not be watching your children and working at the same time, how you would handle clients' protected information, including the storage and disposal. Remember that shredder we talked about. That you have access to high-speed internet and, if necessary, encryption. Your plan for internet outages. Would you go into work? Is there somewhere in the hospital that you would work or in the doctor's office where you would work if you had no internet at home? Who pays for the internet access? What about phone calls? Will they supply you with a landline? Will there be some type of software that you can get for your cell phone or a certain cell phone that you can get? Have this ready to present to them with the cost and everything so they know how much all this is going to be. And then how you would measure your productivity. In my opinion, this should be the same as it was measured when you were working on site. There's really no difference. The people that are working from home should be measured at the same way that the people working on site should be. They should have the same lead and lag indicators. They should have the same caseloads. Outcomes are more important than anything else, not necessarily how many minutes that you're on a phone call or how many keystrokes you're actually typing in. And then make sure you sell yourself and the value. Let them know why you are the person that should be doing this, and the value that this will add to the organization, and anything else you can think of. Now, there are some other pluses that you can mention too. There's no commute time, so you'll be in a better mood. It's better for the environment, frees up parking spaces, frees up office space, and happier employees because they have better work-life balance. One objection employers often has is, well, if I will let you do this, then everybody will want to do it. Well, so what? This will attract more potential employees, which will give you a better pool of candidates to choose from. You will get the cream of the crop. We have covered a lot of information in this episode. You might want to go back and listen again. I hope it has inspired you to think outside the box, to think if your job is in jeopardy, ways that you may be able to add value and stay at the company that you're at. You may have known for a while that you needed to make a change. Often when something like this happens, it is the catalyst for that change. Take this time to reflect on what you want your life to look like once the dust settles. Is a permanent change something you're looking for? Or are you excited about getting back to where you were before this all started? I would love to get your feedback on this episode. If you've actually done any of these things and created a value-added position for your organization, I want to hear about it. If you're suddenly working from home, I want to know how you're adjusting. Do you have any tips that I didn't include? Send your feedback to hello@thestayathomenurse.com. I look forward to hearing from you. And if you haven't done so already, be sure to hit subscribe so you never miss an episode.